Good morning, everyone. My name is Elizabeth Aloni. I'm with Schneps Media. Schneps Media is the largest local media company in the New York metro area. We publish over 80 newspapers, magazines, websites, webinars, podcasts, and events throughout Queens, Brooklyn, the Bronx, Manhattan, Westchester, Long Island, the East End, Philadelphia, now even Palm Beach, Florida. But today we are here with you. And we are thrilled to be able to bringing you heart health and empowering your best life. We're so fortunate to be able to speak with two top cardiologists to learn about keeping our heart healthy. And we're also going to learn how to keep our minds and lives emotionally healthy by planning for and protecting your family. As much as we do to prepare for healthy heart, we must also prepare for heart issues that can impact our future. And we're lucky to have an expert from Cona Law to discuss ways to protect you and your family, and in turn, your heart. So let me please welcome our panelists. First, please welcome Melisa Negrin-Wiener. Melisa manages the Government Benefits Department at Cona Elder Law, concentrating her practice in the areas of asset protection, Medicaid eligibility planning, estate planning, special needs planning, mediation, guardianships, and veteran benefits. She supervises the preparation of Medicaid applications for nursing home care, home health care, and community benefits, resolves complex Medicaid issues, and represents families facing a reduction in Medicaid home care hours and services. She's been named a super lawyer and a 2023 best lawyer, and notable achievements include being named to Leadership in Law, Top 50 Women in Business, Outstanding Women in Law, Top Attorney of North America, and Who's Who's Women in Professional Services, to just name a few. She's accredited by the Department of Veterans Affairs and was admitted to practice before the United States Supreme Court. Welcome, Melisa. Now, please welcome, Dr. Stephen Katz. Dr. Katz earned his medical degree from the University of Cape Town Medical School in South Africa. He interned at Tel Hashomer Hospital in Israel and completed his pathology residency at Boston University Hospital and his medical residency at LIJ Medical Center. Later, he was a cardiology fellow and a cardiology research fellow at Montefiore Medical Center. He began his career as a staff cardiologist at LIJ Medical Center. Dr. Katz was a director of cardiac catheterization for 10 years at Winthrop University Hospital before joining North Shore University in 1991 and overseeing the largest cardiac catheterization laboratory in New York. In 2016, Dr. Katz joined PBMC, where he serves as chair of cardiology and was instrumental in designing the Kansas Regional Heart Center. Wow. Welcome, Dr. Katz.
Thank you.
And now, please welcome Dr. Pilar Stevens-Haynes. Dr. Stevens-Haynes is board certified in cardiology, internal medicine, nuclear cardiology, and echocardiology. She graduated with a bachelor's degree in biology from the State University of New York at Geneseo, right? And obtained a medical degree from the Mount Sinai School of Medicine, where she also completed a residence in internal medicine and a fellowship in cardiology. Her focus has been on non-invasive imaging and inpatient cardiology management. Another wow. Dr. Pilar Stevens-Haynes, welcome.
Thank you so much. It's really nice to be here.
We're so lucky to have all of you here. So let's jump right in. So let me get started with Dr. Katz. Most people have a primary care doctor, but when should one should start scheduling regular checkups with a cardiologist?
So there are multiple risk factors that make it more likely that you could develop coronary disease.
Mm-hmm.
And for me, the most important is family history. If you have a parent or a sibling who developed blockages in their coronary arteries before the age of 75, then that puts you at risk. Secondly, if you've been a diabetic for any period of time, that puts you at risk for developing coronary disease. The other risk factors, which are not as potent, but definitely should raise a red flag, are cigarette smoking, high blood pressure, high cholesterol, and obesity. If any of these are one of your risk factors, then I would recommend that over the age of 50, you should seek a cardiology consultation to try and be proactive in determining whether you have either coronary disease or are heading in that direction.
Very good. And what if you don't have those risk factors, but you just want to make sure your heart is healthy? You know, when should you start a baseline around 50 also? Is that important?
So if you have none of those risk factors and you're asymptomatic, the insurance companies and Medicare will not approve any kind of testing because you don't have a reason to get a test. However, just like you have colonoscopies above a certain age, and you have mammography, even if you don't have a family history of breast cancer, I think that over the age of 50, getting a routine cardiac CT, and I don't mean a calcium score, I mean a cardiac CT, would establish a baseline of whether you have any impending coronary disease or not.
Mm.
And it's a very valuable test. Since it would be difficult to get the insurance company to approve it if you don't have a reason to get it, a lot of places discount it, and out-of-pocket expense could be between $300 and $400. But it's a really worthwhile test in establishing whether you're doing well or whether you're on track to developing problems.
Yeah, I'm a big fan of that test, Dr. Katz, in my office. You know, I agree. A lot of times people come in with no real risk factors and no symptoms. So it's really hard to argue to do a stress test in someone who already feels good because we're not really looking for anything. The purpose of a stress test is if you have a symptom and I'm trying to correlate that with a cardiac issue or a heart blockage, I put you on a treadmill and I'm trying to provoke and see what you're feeling. But if you don't have any symptoms and you kind of want to know, I get that question a lot, like, hey, doc, what's the state of my arteries? Or am I at risk for heart disease? Maybe I have family members over the age of 75. It's not really an additive risk. What can I do to assess? And I always say, if I want to answer that question, the best way is with a scan. And so a coronary calcium score costs about $100 to $125 out of pocket. A coronary CT or a CT scan would be about $300 to $400. And like Dr. Katz said, most people will, places do offer a discount. That's out-of-pocket testing that the insurances haven't quite caught up with what we're knowing, what we can do with technology. But I order those tests probably, if not more often than stress tests in my office. And I like that because what that tells me is that I'm getting consults for people that are really interested in preventative medicine. So I like that rather than come to the cardiologist with a symptom and I'm trying to do a diagnosis. And a lot of times doing secondary prevention, primary prevention is kind of where it's at. We want to prevent disease before it happens. And so these tests are becoming much more popular now.
That's great advice. Thank you.
The other added advantage is in terms of patient compliance in taking medication for lipids or stopping cigarette smoking. If you do a CT scan and you show that there's the beginnings of disease, it's very impactful on the patient, and you get much greater compliance with taking medication and cigarette cessation when you have a test like that.
That makes a lot of sense. I think everyone should note that down and discuss it with the doctor for sure. Thank you for that. So Dr. Stevens-Haynes, you know, we talked about the risk factors, but do these change as we get older? And what about for men and women? Are they the same?
So we used to think that women had a lower risk factor for heart disease, at least until they hit the age of menopause. And then when your estrogen levels change and we kind of even out with the men in terms of risk. The presentation is different sometimes for women and men, but the risk factors kind of stay the same. And so when I talk to people in the office, I kind of divide my risk factors into things that we can control or modifiable and non-modifiable. I can't control family history. I can't control race, ethnicity, age, but we can control smoking. We can control exercise, abdominal obesity. And so those are some of the things that I focus a lot on. As we get older, Hormones change happens in men as well with central abdominal obesity. And that certainly is an independent risk factor for heart disease and metabolic syndrome and all of these things that we kind of hear about that put you at a higher risk for having coronary disease or heart disease.
So men and women, yeah, go ahead, please.
I just want to emphasize a point that Dr. Pilar brought out about men and women. We have a very active program at Peconic Bay for treating patients who come in with a heart attack with stents, opening up the arteries. And I can tell you that the last 4 patients I treated in the last month were all women.
You know, I think women have a misperception that heart attacks and heart problems are a male disease, and it's not. It's a human disease, right? I mean, it's a human ailment.
Absolutely. And, you know, they've done huge pushes with AHA and societies to kind of raise awareness. And you'd be still surprised at how many people come in and they're shocked that they're actually having a heart attack because we just don't associate it with being a women's issue or a women's disease. And, you know, they've done studies that look at that, and women are much more preoccupied with breast cancer and fearful of going for annual mammograms than they are of knowing the status of their heart. And that's very real data.
Really? So, you know what, since you brought that up, I'd love to know, what should people look out for in terms of a symptom of a heart attack and heart problems? And as you said, you know, they may be a little bit different for men and women. Dr. Katz, do you want to get us started with that, sharing with us a little bit about what people should look out for?
Sure. So about a week ago, a 60-year-old woman at 3 o'clock in the morning came into the emergency room because she wasn't feeling well, and she took her dog's antibiotics, and then her throat started to tighten up, and she thought she was having an allergic reaction. And she had no risk factors, on no medication, no family history. The only risk factor really is that she was once encouraged to take a statin and she didn't.
To take a what? To take a what? I'm sorry?
Statin to treat her cholesterol.
Okay.
And she came in at 3 in the morning and was having a heart attack.
Wow.
A serious heart attack, and ended up getting a stent to the artery in the front of the heart. So, you know, as Dr. Pilar said, number one, women think that they don't have it as often as men do. And number two, when they show up in the ER, they don't get the same kind of attention that a man showing up in the ER with throat tightness would.
Wow.
Because you got a woman with throat tightness who has no risk factors, is on no medications, not seeing any doctors. Last thing you think is that she's having a heart attack.
So it's not only people who misdiagnose themselves, but even in the ER, in the triage, they're not thinking that it's a heart. So what should someone do if I'm not feeling well and I feel that I need to go to the ER, and I'm not a doctor, I don't know what's wrong with me. I mean, here she thought she was getting an allergic reaction from an antibiotic.
Yeah.
What do you recommend that we do to, advocate for ourselves so that we can make sure that, this is looked at?
Well, I think in an emergency situation, you should make sure they do an EKG.
EKG.
Yeah, because that's what, you don't usually do an EKG for an allergic reaction.
Right.
But I think that since the prevalence is quite high, and let me say the following, I worked in Nassau County for 26 years. In Nassau County, there's a high degree of cigarette cessation. There's lots of programs for encouraging people not to smoke. We do not have the same thing in Suffolk County. And so the smoking rate in Suffolk County is much higher. Just about everybody smokes.
Wow.
Yeah.
Well, that's a real testament to advertising, how important it is. It's amazing that you can right there see the difference. That's mind blowing.
Yeah. So I see a lot of patients. I've been out here 6 years now, and I'm amazed at how everybody smokes.
Mm. And smoking is so dangerous, not just to your heart, but really every single cancer, disease is all, I mean, I have the fortune of speaking to many different doctors, and it's like every disease, they say, smoking.
Yeah.
Unbelievable. So, what can we do to help ourselves? Dr. Stevens-Haynes, you talk about weight, but specifically, what are some things we can do to lower our risk for heart disease with exercise and food? Are there some specifics we can think about?
Absolutely. I just want to touch on one point that Dr. Katz had mentioned about this patient and some of the things that you can do in terms of going to the ER. I would strongly encourage and insist that you do not drive yourself to the emergency room. Okay, I just want to highlight that because I have had a few patients in my career that have driven themselves from a doctor's office, from home, from an urgent care place because they were having some chest discomfort and were advised. And I actually had one of my patients say, "Oh, I didn't want to make a big deal." She was horrified at the fact that the ambulance was going to come down her block and make a huge deal, and all of her neighbors would know. So her husband actually drove her. She made it to the ER and she, did fine. But I had two patients whose spouses drove them to the ER because they didn't want to call an ambulance. And one actually had a fatal arrhythmia on the way to the ER. And so the reason why we call the ambulance is because that we have EMS and we have trained people to start treatment right away, to monitor you on a heart monitor and to administer medications, none of which you can have if you're in the car sitting next to your spouse. And so I just want to highlight that message because I think it's important, especially for everybody, but especially in women, because we tend to want to downplay. We don't like a lot of attention being drawn to us. Take the attention, take the ride, because it can really save your life. And so I just wanted to point that out in an emergency setting. Things that we could kind of do to prevent heart disease and lower our risks are diet and exercise. I used to think maybe about a year or two ago that, oh my gosh, in my busy schedule, taking call, being a mom, working, doing all of this stuff, I don't have time to do 30 or 60 minutes to go to the gym. My husband could be in the gym for 2 hours, but he doesn't have to worry about dinner. I don't have the time for that. So what I learned in actually doing these talks and looking into things a little bit more is that it doesn't have to be 30 minutes to an hour of consecutive exercise, or continuous exercise, I should say. It can really be about 10 minutes. So I can break it up into 10-minute blocks, which is really like 2 dance songs. So I put on music in the house and I dance around with my kids and I try to make some kind of activity, but it's less overwhelming to me if I don't have to think to myself, oh, I need to carve out an hour of my time today to do exercise or go to the gym. But what I can do is put the baby in the stroller and do a 10-minute walk. And if I do that a couple of times or do a 10-minute walk and a couple of dances, I kind of get my steps in. And so I'm very conscious of that now. I think more so now than I was in the past.
That's really great advice. And that's good to know because I'm always curious about that. Do you have to do it in one chunk or does it still count if you mix it up? That's wonderful.
It definitely counts. It counts.
Good to know. So in terms of food, I mean, I know it's things like, fried foods and, things like that. Are there any foods that are particularly beneficial to the heart? They say carrots are good for your eyes. I don't know if that's true. But, are there any foods that are like heart foods?
So I have a sort of iconoclastic approach about food. I used to be fanatic myself and also with the patients. But my approach now is you can eat what you want, but if your numbers are not good, I'm just going to give you more medication. And if you want to take less medication, then eat properly and avoid the fatty foods, the foods that you know are not good for you.
Right. Okay. Well, that speaks to enjoy your life and also see your doctor to make sure you have a baseline so you know where you are and what you're doing. So, what would be one thing each of you would say that someone could do today to start improving their cardiovascular health?
Get moving. I'm going to say move. Get moving. I think it's so important. Also, as we push ourselves, if you lead a relatively sedentary lifestyle, you don't know if you have symptoms of heart disease or a heart blockage because you're not doing much. And so it takes very little, like I said, 10-minute intervals. It takes very little, 2 songs of dancing, a short brisk walk to really get moving. And I think we would be surprised at the positive effects that has on blood pressure, abdominal fat, and really lowering your risk for heart disease.
That's great. That's wonderful. Ooh, did we lose Dr. Katz? Well, when he comes back, we'll get his one thing, but I think it would be eat healthy.
I would say eat healthy, low salt. And if you're a smoker, really look into those programs, because when I speak to my interventionalist after an angiogram, they tell me they can always tell if someone's a smoker or a diabetic, because the arteries just look so bad and they have so much disease. And I can give a pill for cholesterol, I can treat diabetes, I can treat high blood pressure. There's no pill that can reverse the effects of smoking. And so we can't overcome it. And people always ask me, how do I know this is not going to happen to me again? Or what can I do to lower my risk? And I say, listen, if we're taking our medications correctly and we're controlling our risk factors and you're dieting and exercising and doing everything, the chances of you having another event are very low. People I cannot say that to are people that continue to smoke and people that have really out of control diabetes, because I just can't overcome it. And so I think that those are the big take homes, that get moving and really, really talk to your doctors about getting help if you need help to stop smoking.
Great. That's really great advice. Thank you so much. So, I want to kind of pivot a little bit because, no matter what we do, we are all human and things happen in our lives, in our bodies. And it's important to be prepared for those times and protect our families. When we're thinking about our future health, Melisa, I'm going to turn to you. What are some of the things from a planning perspective outside of medicine can we do to protect our families and ourselves?
Elizabeth, it's really interesting listening to this. I think there's like an overarching theme of being proactive, right? Being proactive with your health, being proactive with your finances, being proactive with getting all of your legal affairs in order. A lot of times people will think, oh, well, if I go and do my will, something's going to happen to me. They have this kind of thought that but it's really about being proactive and making sure that you have all of your ducks in a row before a crisis, because no one has a crystal ball. And you're right. I mean, we can take really good care of ourselves and, health-wise, but you could still have an accident or an injury where there's some sort of major crisis that occurs. And if you're not properly prepared from a legal perspective, you can end up with some real problems. For example, we always talk to our clients about power of attorney, healthcare proxy, these legal documents that people don't really think about, and they correlate them to being old and being sick. But really, once you turn 18, there's nobody with the legal authority to help you if you become incapacitated, whether it's from a heart, a crisis that occurs where someone maybe lacks oxygen to the brain and now they no longer have the mental capacity to make their own decisions. If it's an injury, if it's an accident, there's no one with the legal authority to really step in and make decisions on your behalf once you turn 18, which so many people can't believe, especially, if they have 18-year-old children, because really you think I'm still taking care of them when they're 18, right? So
it doesn't matter how much money you have invested.
No, it doesn't matter if you're paying for college, if you're paying for room and board, whatever they still have, they're an adult at 18 and you don't have the right to make decisions or get information.
And neither does marriage. What about marriage? I mean, marriage doesn't protect you either.
No, just because you're a spouse doesn't mean that you have the legal authority to do all of the things that you and I can do for ourselves. So having a power of attorney where you name someone to handle your finances, if you become incapacitated and you can no longer pay your bills, or I run the government benefits department. If somebody needs to apply for a government benefit, disability, something like that, you need to have somebody with the legal authority to do that. Being a spouse doesn't give you the legal authority to do that. And when it comes to your health, having a healthcare proxy in place, someone who is designated by you to speak to the doctors and to get medical information. I'm sure Dr. Stevens-Haynes could attest to the fact that families don't always get along and they don't always have the same opinion when it comes to their loved one. And you, right, as your own person, you want to make the decision of who's going to be the one to talk to the doctors. We have something in New York State called the Family Healthcare Decisions Act. So if there's no healthcare proxy in place, the statute tells us tells the doctors who they can take direction from in a specific order. But that doesn't necessarily jive with who you would want to be making decisions on your behalf. And when you're in a crisis, you want it to be that person that you choose and that person that you want. So, aside from all of the other estate planning, getting your finances in order, asset protection, and all of these other things that we help people with, these documents, the power of attorney and the healthcare proxy, are so important because anything can happen to anybody at any time. I think COVID really opened people's eyes to that. And we've seen younger and younger people coming in to have their documents done. But we all know that that's going to kind of, hopefully be in the rearview mirror, and people are going to start to not think about it anymore. And, just as we're talking about being proactive with our health, and I am going to get out of my chair and walk for 10 minutes when we're done with this, because I'm as busy as they come, but all I do is sit, whether it's in the car, at my desk, it doesn't matter.
Yeah.
But being proactive in that way, you really need to be proactive with getting those legal affairs in order.
And it certainly gives you peace of mind. I know when I got mine in order, it was just like a weight lifted off my head that I knew, you know what, I'm doing the right thing. I'm protecting my family. I'm protecting my children.
Yeah.
I can't emphasize that enough, sometimes from the inpatient side when things are going bad or they're in crisis, and you have family members that need to come together and to try to get everyone on the same page, or try to get last best expressed wishes, and you're trying to navigate. It's so scary. It's so overwhelming. And it's can be such a burden on the people that are not in the bed, because they're trying to come together and you're trying your best to explain. And so the cases that I've had where there have been discussions and someone's appointed because, mommy knew that I'm the tough one. I'm going to get everything done right. So I'm the healthcare proxy. This is who we talk to. This is who we communicate with, because it's really hard, especially when there's disagreement and families feel like they're being pressured to make rapid decisions about something that's really scary. It's health, their family's vulnerable, people are sick, and it's a lot of pressure to be able to have to answer all of those questions. So if some of these things are in order and well established before things happen, it's such a relief. And families really, because these things can kind of tear people apart.
Oh, absolutely. And in New York State too, it's really a big burden on the healthcare agent, right? Because they could make end-of-life decisions in New York. So having a living will, which is, even though it's not a required document in New York State, it's so important because that's where you put your wishes regarding end-of-life decisions. What do you want? What type of, life-sustaining treatment, for how long? I mean, you can really specify these documents to be exactly what you want. And, of course, it's always interesting when I meet with people because, when I meet with people in their 80s and their 90s and their 100s, because now that's kind of just a regular occurrence. I don't want that. I don't want the machines. I don't want any of it. They know. But the younger people this becomes a much bigger conversation that 21 years ago when I started doing this, I really never had to have that conversation because people that were younger were not doing these documents. So having that living will, like you were saying, Dr. Stevens-Haynes, about that says, what you would want to happen, really takes the burden off of the person making the decision.
So, Melisa, what would be, the key, if someone said, I don't even know where to begin, what would you say would be like the key documents that someone should have in place?
It's the Advance Directives, the power of attorney, the healthcare proxy, and the living will, for sure. And of course, a will. I mean, it's important for everybody to have a will, and I could talk about that for hours, but even younger people who maybe would say, I don't really have any assets. Why do I need a will? Well, guess what? If you have minor children and something happens to you and their other parents, your will is going to be what dictates what happens to those children. So it's that important. But really that power of attorney, healthcare proxy, living will kind of combination of documents is really if you could get that done and know that it's there and it's a good document. Okay, I'm not talking about just popping it off the internet, because you want to make sure you have the right language. There's HIPAA language, the Privacy Act, doctors, hospitals. I'm sure the doctors could attest to this. It's a serious thing about giving out somebody's medical information. So you want to have that appropriate language in those documents, and so many healthcare proxies we see don't have the HIPAA language, the Privacy Act. It's very important to have that. So you want to have things prepared, by a professional that this is what they do, and that's what we do.
That's a really good point, because people are so into Google these days, right? And it's like don't think Google is a medical license, and certainly do not think it's a legal law license. And I think people think, oh, I can just go online and get one of these www.will.com. I don't even know if that's a website, but if it is, don't go to it. But they think that that's what they can do. Why is it important to go to an expert for these type of things? I mean, obviously we know critically important for go to a cardiologist if you have a heart problem, not a foot doctor. Why is it so important to go to a professional to deal with these important documents?
It's even more than just going to a professional, but like you just said, you wouldn't go to a foot doctor for a heart problem. You wouldn't go to a general attorney or a matrimonial attorney for estate planning documents, because all of the things that we deal with on a daily basis, applying for government benefits, working with families, where somebody is ill or injured, there are very specific parts of these documents that don't get into a standard form that somebody might have. Okay. For example, there are websites out there. I've had people come in and they're like, oh yeah, I have my power of attorney. And I look at it and I'm like, well, this is a Kansas power of attorney, because they downloaded it off the internet. And, it's a completely different document. And it's not going to be recognized here. So, it's just like anything else. It's, the professionals are professionals for a reason. And
there are so many nuances. It's like you think, oh, I just need to figure out where my kids are going to be, or, oh, I just need to figure out. But, when I've talked with you in the past, Melisa, you've, walked through so many scenarios and questions that honestly, a person who doesn't do this every day would never think of. So, that's also something that I've learned from you that is so important, to make sure that you're with someone who can kind of strategize with you, and based on your personal life and finances, to make sure that all those things are touched upon.
Yeah, and I'm sure the doctors could speak to this too. If these documents aren't in place and there's a crisis and the patients can't make their own decisions, the family may have to bring a guardianship proceeding, or the facility, if there's no real next of kin type family member or someone to bring a guardianship proceeding. And now you have the courts choosing the person who's going to make these decisions. That could really, you could end up with an independent guardian who you've never spoken to before in your life. So, just doing that and being proactive and having your own wishes on paper, it's everything.
Well, what does happen? Someone is in a situation, you said about a guardianship, let's say someone passes away. I mean, what happens if there's no, documentation, no legal?
Well, when someone passes away, and there's nothing in place, the family can bring an administration proceeding in the courts because there's no will or something like that. But I'm talking about somebody who is maybe being kept alive by machines. The question is, are we keeping them this way, or are we removing machines? There's nobody to make the decision, or their family can't agree because there's no documents in place. And now we're bringing a guardianship proceeding in the courts so that the judge can appoint somebody to make that decision, or the courts can make that decision. And it takes a lot of time. It's extraordinarily expensive. Families who are fighting typically don't come back from that type of situation when it gets to that point. And at the end of the day, it's the patient who's suffering. So it's really important to avoid that type of situation.
So what's the first step someone should do when they want to put these documents into place? You know, what's the first step?
Yeah, pick up the phone. You know, our office, we offer free consultations, you know, nothing to lose. Have a conversation. You know, we send out a questionnaire. We want some information so we can make the best recommendations for you and help you kind of talk through who the right people are. You know, it's never advisable to choose your healthcare proxy just because your kids have, you know, you want to go in age order because you don't want to upset the oldest child or the only boy or the only girl or whatever the case may be. You know, so we help people to kind of talk through the process of who the right person would be. So it's just as simple as reaching out and coming in and having a conversation.
I'm actually right now putting your phone number and email in the chat.
Thank you.
I'm also going to share it on the screen so everyone can see it. But also, you know, along those lines, Dr. Stevens-Haynes, what would you recommend is the best step for someone in terms of heart health? You know, what should there be first step? You know, I saw someone put in the chat, which was great, you know, talking about how you and Dr. Katz are so personable and easy, you know, so not only have incredible experience, but also, you know, make everyone feel so comfortable. You know, how does someone, you know, find a doctor, the right doctor? And, you know, what do you recommend as a first step, you know, for everyone who's here today listening to this?
So I usually say talk to your internist. When I'm doing referrals, I try to match personalities. And so sometimes it can be hit or miss. Sometimes I think it'll be a good match, but it's not. But what's important? Do you feel comfortable with women physicians? Would you like a male doctor? Sometimes when we talk about things with heart disease and erectile dysfunction, my male patients get all red in the face and they get uncomfortable. And so sometimes that conversation is better had, or they feel more comfortable with my male partners. So I would really say it starts with your primary physician, and the better relationship that you have with them, they can kind of figure out and establish and make a few recommendations. Google is hit or miss. Sometimes, you know, you have all of these different review systems, and you can read about and how many stars this doctor got versus this doctor. Hit or miss. So I usually rely on the insight of my internal medicine physicians and having a good solid foundation. I think that's probably the best way to start. There was a question in the chat that said, look, if you have no symptoms, you feel well, and you have no real risk factors, what do I get? Like, what does my insurance cover? What can I do? And so I usually screen patients at least twice a year for diabetes, cholesterol, high blood pressure, abdominal fat or weight. We didn't speak much about it, but there's a waist to hip ratio. As that number approaches 1 and over, put you at higher risk for heart disease. It's not something, you know, when you get out the tape measure, I did it for a year in my house, I'm going to admit. It's something that I love to do. But it definitely is nice when you see that waist kind of coming in a little bit with your exercising and diet. I went on a very low to no carb diet, and that seemed to work for me for a little bit. And so those are some of the simple things that you can kind of do in the privacy of your house. It doesn't always have to be under a doctor's supervision. That's a tape measure that you can do. And I had a little document that I would kind of track, and I wanted to bring myself down to a certain number. So I was really, really careful about that.
Nice. So, you know, one of the questions that came in from a participant, Elizabeth, she said, you know, how do I communicate with my doctor so that they can understand what my needs are and my concerns?
So I think that's really individual. I have an open email policy, so my patients know unless I'm out of the country, I'm probably going to respond within 24 hours. But that's, you have to evolve. As technology evolved, I used to have an attending who said, I don't have my cell phone. I'm not putting my email on my cell phone. I think that's unheard of in 2023. We have this expectation that, with these smartphones and rapid response, and EMRs, and there's ways to leave messages for your doctor within your electronic medical record. And so I really encourage, I manage my mom's because she's like, oh, I'm too old. I don't want to do this. I said, you have to keep up with the time, Mom, because this is how we communicate now. Don't sit at home waiting for your doctor to call and go over your results. You can follow my health now. You get your results sometimes faster than I do. And let's figure this out. And so I think finding a doctor that kind of meets your needs and is on that same level as you are is important, right? So if I'm someone who I like a 24-hour response. So I try to give that to my patients because that's what I would expect, right? I wouldn't do well with somebody who calls at the end of the week or makes once a week phone calls. So I think matching that need and making sure that, look, I have these expectations. I like phone calls. I like to be able to communicate through the internet. Can I email you? And having someone who's kind of in tune with what your needs are is really, really important because you don't need to get or create feelings of being disgruntled because you're not on the same page in terms of communication.
That makes a lot of sense. So we have another question here. Anna wants to know, are you seeing patients younger with heart disease? And
absolutely.
What are the symptoms that people should look out for specifically?
So we absolutely are. It was one of the things that Michelle Obama really, really pushed during the Obama years, because it really starts in adolescence and young adolescents. And I think the reason is we're seeing a lot more childhood obesity, diabetes, hypertension, and high cholesterol. And so her whole Get Moving campaign and taking the vending machines out of schools, et cetera, was really targeting or trying to target that trend that we're seeing in America. And so we're definitely seeing younger women in their 40s, 30s. And like Dr. Katz mentioned, it's not even on your radar sometimes in the ER because we don't see patients. You think of heart disease as usually an older person's disease. So why would this 35-year-old be coming in with heart disease? That's crazy. But if you've had diabetes for 10 years or 15 years since you were a child, you're at higher risk for heart disease and you're going to present younger. Some of the symptoms, because younger patients are a little bit more well compensated, could be things like shortness of breath, a fatigue, a change in exercise pattern. So I always say my whole get up and moving, if you're used to being able to walk 2 miles in 10, 15 minutes, and all of a sudden now I'm walking down the block and I have to stop because I'm a little out of breath, or I noticed when I ran up the stairs with my laundry basket, I had to sit down for a minute. Those are new or changing symptoms, sometimes could indicate there's something going on with the heart, and they at least warrant a hey doc, I noticed this. Anything that we should be doing different or anything that I should look out for? And I think that's important.
Great, thank you. Also, we have another question. Is BMI still considered an effective way to track obesity?
It is, and we definitely do use it. I think that what I'm referring to with this central obesity or abdominal fat is a little bit more popular nowadays, because it's not just having whole body BMI, it's really that abdominal fat that we know is at an increased risk for heart disease and metabolic syndrome. And so when you're talking specifically about heart disease, that's what we're targeting or looking at more so than BMI. They do document it, we do record it, but if you look at most of the latest literature, it really focuses on this abdominal fat.
Great, thank you for that. So someone asked, what does it mean when you hear your heartbeat in your ears?
So I responded to that one. It's called pulsatile tinnitus and tinnitus, and sometimes it can really be as simple as having a partially clogged ear. So if it's not consistent and it happens sporadically when you're running up the stairs or doing something, it's probably more likely that it's partially clogged. But if it's something that's consistent and persistent, it could mean something with the blood vessels, either a blockage or a congenital abnormality. And it's something to mention to your doctor, because they may do imaging on that side with ultrasound to make sure that the flow is okay.
Okay. And I think that's an important point. Mention it to your doctor. We're not doctors.
Absolutely, absolutely, absolutely.
So another question I see you may have answered here, but everyone may not have seen it. What cardiovascular primary prevention tests services are currently covered by basic insurance without patient risk or symptoms?
So without any risk factors, you're doing annual. I usually recommend at least twice a year. Some people do it 3 times a year, but it's really about screening and primary prevention. So what are you entitled to? A basic EKG, right? Cholesterol screening, diabetes screening, blood pressure, BMI or weight management would be all of those things, because what you're really doing is targeting risk factors, smoking cessation and counseling, all of the big risk factors that we know would put you at a higher risk for heart disease. We're going to target and screen and make sure that you're within normal limits on all of those categories.
Fantastic. Bethany wants to know, how important is cardiac health in the use of healthy oils? Is it better to remove oils altogether?
So that was a big push maybe about 10 years ago to kind of change our cooking oils from vegetable oil to olive oil. And there's some data that supports using olive oil or avocado oil or grapeseed oil is a little bit better than frying your food in regular traditional vegetable oil. Probably not a whole lot of a difference in terms of your overall panel. But small differences in cooking and the food preparation can make the difference. It impacts your cholesterol.
Okay. And one more question for you on this is, can you talk about the effect of different methods of birth control on the heart?
Oh, interesting. So birth control, it's hormone manipulation, right? And so sometimes what we see is there's an increased risk of high blood pressure, and certainly a real risk of clotting with birth control, especially over the age of 35 with some of the hormones. Now they've lowered from back when I was younger, the birth control, the levels of estrogen and progesterone supplementation were high, right? We had the high dose, we had the low dose. Now pretty much everyone, they figured out they can control with low dose. So they do offer the lowest dose possible. That being said, there is a relationship between birth control pills and high blood pressure and clotting. And so it's really important, especially over the age of 35, to monitor your blood pressure. It's one of the first things I usually discontinue if I'm seeing a young patient with high blood pressure, just to see what the effects are. And if I can get you back down to normal outside of the medication, I would certainly prefer to do that. But those are the 2 biggest things with birth control.
Very interesting. Thank you. And I want to turn to you, Melisa, because where Regina wanted to talk about, some of these free things on the internet. What are some of the concerns around it?
Yeah, so there's a lot of different kits and documents available on the internet with power of attorney or with a will, a healthcare proxy. And the real problem, again, is like I've said, I've seen people come in and they have documents from another state because it's not clear. People don't realize they're not looking at a New York document. And it's a problem. And I really have never found a website where you're going to get the language that you need in a crisis situation. Just for example, a power of attorney. If you have a power of attorney, you take a look at it. The forms have changed in New York over the years, and pretty recently. And there's a section on there that says modifications, and it's blank underneath. So many times I have people come to me and it's still, they said, I had this done by my real estate attorney and here it is. And it's a perfectly fine document. It's executed properly, but that modification section is blank. It's remained blank. If you use an office like ours, an elder law firm that understands and knows all of the rules behind asset protection planning and long-term care planning, your modification section is going to be a few pages long because we love to modify things, right? As lawyers, right, we love words. So we modify all of the power of attorney language to make sure that when this crisis happens, the person who you're naming as your agent can just go and do what they need to do. And they're not first fighting this battle and getting over this hump of, do I have the legal authority to do it? And if I have this piece of paper, is it properly executed? So I think, from a risk perspective, using anything downloaded online, you're just never going to get that language that you need.
That's really good to know. One other question that came in, how often do these need to be updated? So how often do you need to update your documents?
Good question. Barring any major life occurrences, kind of like barring any major health occurrences, and when I say major life occurrences, you're getting married, having a child, buying a home, retirement, you're going to want to look at your documents and see if you want to make any changes. But really, every 2 to 3 years, think about it. Perhaps, now you used to have your sister as your healthcare agent, and maybe now you have grown children and you think, okay, it's time to make that change. I will tell you, I have people who come in their 80s and 90s who still have their wills from when their children were babies. At least they have one, but they kind of set it and forget it, and you can't really do that. So I would say, 2 to 3 years, take a look at it. It doesn't mean you have to change it every 2 to 3 years, but you have to think about it.
I just want to point out as well, that's so, so important, especially with life-changing events, birth of children, divorce. I will say it's very difficult. We had a case where we were trying to contact someone's ex-spouse because that was who was listed. Exactly. You can just imagine that. You saw her face, right? I didn't have to say anything else.
It wasn't the ex-mother-in-law. No, I'm just kidding.
So these things kind of happen and you just kind of forget because, it's not on your radar. And some people really do believe like it's calling karma. So they don't want to, look and have to address these things. But if you don't, these are the things that happen. And again, in an emergency situation, and, we're the physicians, I'm just trying to dial any number in the chart and see who I can get in contact with because I can't speak with the patient, and having someone say, well, I'm the ex, I don't want to make that decision. And the girlfriend sitting right here. And it just, it can be very, very messy. So any life-changing event, I would strongly encourage.
Yeah.
Oops, you just put yourself on mute by accident.
Oh, sorry. Okay. Did you hear that? Just strongly encourage with any of those life-changing events to please look at the documents because it can create really, really tricky situations.
Elizabeth, can I ask the doctor a question?
Sure.
Okay. I'm just listening to everything that you're saying. And I guess my question is, if I'm being treated for high blood pressure, so I'm good, I go to the doctors, I'm very good at, I listen, I do what I'm supposed to do, I take my medication, and my blood pressure is pretty good all the time, but I'm taking medication. Am I still considered a person with high blood pressure?
Absolutely.
Okay.
Because it's treated. And I get this question a lot because a lot of people say, listen, I don't want to be on medications for life, or how come you guys always start me on stuff and you never take me off of it? Why do I have to keep taking these medications? So I would say, listen, it depends on your risk factors. If you're someone who comes in with just high blood pressure and you say, look, Pilar, I'm going to be meticulous with my exercise. I've dieted. I've lost 10 pounds. I cut out salt from my diet completely. Nothing by can, nothing by bag. I don't add any salt. My blood pressure has been excellently controlled. I'm still taking the medicine. Can we try and see what I do on my own without it? There's lots of blood pressure cuffs. You can buy them in any drugstore now. And I have no problem. In fact, I have stopped blood pressure and cholesterol medications just to kind of see what someone can do on their own. I think especially with exercise. Listen, I've been able to stop diabetic meds. I've been able to stop high blood pressure meds. And I really think that that's such positive feedback when someone's exercising and doing everything right, and you get to take away a medication. It's a lot of fun for me too. So I always say that, listen, in this day and age, nothing is permanent or definite. That's the beauty of doing primary prevention. The game changes completely once you have established disease. I'm obligated to be aggressive as possible. That usually includes medications, but for primary prevention that's well controlled, I think finding a doctor that'll be willing to work with you, and you do a trial. So I say, okay, we'll hold your medication. I'll see you back in a month instead of 3. Let's see how you're doing. You have your machine. You're going to email me because I respond to my emails in 24 hours. So you're going to email me if you see anything. Those numbers go up and we'll set parameters of what we don't want to see.
Gotcha. I like that. Okay.
Well, this has been truly, truly a pleasure and so incredibly informative. Thank you so much to Dr. Stevens-Haynes. Thank you to Dr. Katz, who, obviously work calls, so he had to leave. Melisa, thank you so much. Please, reach out to Melisa. Her number is 631-390-5000. Very easy. And her email, Negrin, N as in Nancy, EGRIN as in Nancy at conalaw.com. At least get a consultation. It's free, and at least you can know where you are and what you need to do. And I know that I'm going to continue with my 10-minute burst because I'm a big believer in that. In between a call, I'm like, let me go do it. And I hope everyone here will add exercise, quit smoking, as we shared, southnassau.org. Thank you so much, Mount Sinai, for having you here and for you being here. Truly, you take away all the fear of wanting to see a doctor. I wish every doctor was as wonderful as you. So everyone, thank you. Our attendees, thank you for being here with us this morning. I hope that you learned a lot, and we'll get started on your health and your legal important papers as well. Everyone have a wonderful day. Stay safe, stay healthy, and we'll look forward to seeing you on a future webinar. Bye, everyone.
Thanks so much. Bye.